Good morning. Welcome to day 15 of the Mitchell Talks Facebook Live. Oklahoma mobilizes against COVID-19, program designed to bring you news and information about Oklahoma's battle against the coronavirus. If this is your first time you've seen our stream, my name is Scott Mitchell, and my Facebook page and Twitter handle are the same, Mitchell Talks. If you're interested in staying up to date on COVID-19, health, financial, announcements, education, all of these things, we cover this every day. Important to note, we've moved our starting time to 10 a.m. We were the first 14 days starting at 9. Now we're starting at 10 a.m. So if you want to stay established with information from us, well, that's when we'll be doing it, except we'll make changes once in a while. So if you'll do this to make sure you know when we're making any changes or we're doing extra special programming or content, go to following on Mitchell Talks Facebook page. Click on the See First button. Make sure that your notifications are on for the Mitchell Talks program. Make sure they're on. On Twitter, you can also turn on notifications when we go live because we're also on Twitter through our platforms. And as we say every time we're talking to state leaders, we're talking to health officials, doctors, business leaders, entrepreneurs, bankers, all the folks that are involved in fighting this COVID-19. We are going to be joined in just a few minutes, and a few moments actually, by the Executive Director of the Oklahoma City County Health Department, Dr. Patrick McGaugh. We're also going to be talking with Dr. Bookman, the President of the State Medical Association, towards the bottom of the hour. And our plans are at about 11 o'clock, we'll be talking to Jill Castilla, who is the President and CEO of Citizens Bank Edmond, who has some interesting tweets about SBA loans, things that need to be done in terms of your business. Also, one other announcement yesterday, we had a lot of questions for Chris Marble, the CPA at CMM Financial, that is. And guess what? Chris is busy, forwarded that information on to him. His clients are listening to his own advice, which is get your taxes filed. So we'll have that information for folks that were writing in yesterday. We'll keep that going. The best way to contact me on issues like that is to send me email at Scott@MitchellTalks, and we'll pass that information on, and we'll have updates from education, nonprofits, all of these things this week. We're glad you're joining us. So let's take a look at today's headlines before we get to Dr. McGaugh. Currently, the Oklahoma State Department of Health reports 429 positive tests. Those numbers change about midday, so these numbers will be old by this afternoon. But 429, 16 people have lost their lives in coronavirus-related illnesses since the start of this pandemic. 1,205 people have tested negative. As always, the 65-plus age group is the one out by far that is being most affected in terms of Oklahoma. More women than men. It's not a significant number, but more women than men have tested positive in Oklahoma, but more men than women have died from issues related to the coronavirus. Right now, 44, the number's up to 44 of Oklahoma counties who have gotten COVID-19 cases, which means they'll have to enact those safer at home executive orders that Governor Stitt has put out. Here's our second headline. President Trump reversed himself yesterday. He's extending the national social distancing platforms down to April 30th. So he's all the way up to April 30th to keep the projected coronavirus death toll from reaching the catastrophic worst-case scenarios it has in other parts of the world. The president said previously he wanted the country to reopen for business by Easter, but public health officials have warned that loosening restrictions by Easter, April 12th, would result in unnecessary death and economic damage. The president had suggested the coronavirus death rate would likely peak within about 2 weeks. Our third headline, we're going to get to that just right about now. A new uninsured health line is going to be opened up by the Oklahoma City County Health Department, Variety Care, and we're going to try to bring on right now our first guest. He is the executive director of the Oklahoma City County Health Department, Dr. Patrick McGaugh, and we're waiting on that, see if we can get that.
Scott, I'm here.
All right. Joe, we have Patrick McGaugh on. Have you got it up there? Yes, I do. Just a moment, please. Just checking a couple of things here quickly. All right. We're double checking. So sometimes, whenever that you're dealing with Facebook, you have interesting things happen. I'm going to take a real quick check here.
That's fine.
I do not see us. We appear to be streaming, but it doesn't appear on our. Stand by, Dr. McGaw.
Sure, it's perfectly fine.
Well, we're going to go forward. If you have, if anybody can send me a text message to make sure that we're on, that would be very helpful because I don't see it on this end either. I don't know if it is streaming or not. All right. Here's what we're going to do. Patrick, we're going to hang up right now. We're going to reboot. And in fact, I'm going to send a message right now to someone to check and see if we're still. Hang on just a moment here. I'm getting a note. Looks like we're on. Okay. So I apologize that. All right. These things happen in live Facebook/Twitter broadcast. It's good to have you on, Dr. McGaw.
Thank you. It's really nice to be here.
I know that you're probably looking for things to do these days.
That's not really a need at the moment. That's not a need, but it is very nice to be here. I want to pursue every opportunity to just kind of communicate with folks what we really need to be doing, and so I'm happy to be on.
All right, let's start with what we said was the third headline of the day, and that is a hotline that Oklahoma City County, and I believe this is Variety Care is working with you on this. Tell us what this new, I'm going to get to your press release here. I'm semi-discombobulated here, so I got to read this. Hotline for uninsured established will serve individuals needing physician guidance on COVID-19 testing. Take us through this. This has got your brand and also Variety Care Health Centers on this press release. The headline, Hotline for Uninsured Established.
Yes. And so, as you well know, with all of the different communications that you've had, we have established a site for testing, and that site had been and is predominantly for testing first responders and healthcare workers, and also then for people that met the CDC criteria. And then consistently, you've heard a message that's gone out to the public that would say, don't go to ER, call your doctor, and then go see your primary care provider. Well, we consistently had a lot of questions about what if I don't have insurance, and what if I don't have a primary care provider? And so this is a joint project with a number of community partners, and primarily Variety Care and HAU, the Health Alliance for Uninsured, and of course OCCHD. And so we're happy to make this available. And so what will happen now is simply that people can call our hotline, which we have converted into a hotline/triage line. And if they don't have insurance, or if they don't have a primary care provider, they would start there. And then what happens is they'll funnel them through the process, and if a referral is needed to be tested, that will be done. The medical referral is actually given by Variety Care, and then they send that to OCCHD. OCCHD turns around and gives the person an appointment time to show up at our sampling site.
Patrick,
yes.
We're going to reboot. We do not appear to be streaming. We don't think that we are. So we're going to reboot in just a second.
That sounds good.
Now we're live. All right. Just a second here. If you're just joining us, we're having a little. Yeah, I have. I don't know if any of your folks can see whether or not that we're live, but we're going to go ahead and restart. So if you folks that are joining us, Ixnix, give us a couple of minutes. We're going to reboot this and be right back.